Rotator cuff tear is a common shoulder injury that increases in prevalence with age. While rotator cuff tear can be effectively treated with arthroscopic rotator cuff repair, the postoperative re-tear rates following arthroscopic rotator cuff repair remain high, ranging from 20% to 94%. To reduce re-tear rates, biological augmentation aimed at improving bone-tendon interface healing has emerged as a promising strategy. However, selection of an appropriate cell source remains a challenge. Dermal fibroblasts, which are easily accessible and can synthesize collagen like tenocytes, may be a promising cell source for tendon engineering. While they have demonstrated effectiveness in bone-tendon interface healing in rotator cuff tear rabbit models, their effectiveness in humans remains unknown. Researchers from the Republic of Korea have conducted a prospective randomized controlled trial to assess the efficacy of autologous dermal fibroblasts in patients with full-thickness rotator cuff tears greater than 2 centimeters undergoing arthroscopic rotator cuff repair. They recruited 86 patients and randomized them into 2 groups. The autologous dermal fibroblast group, which received an additional autologous dermal fibroblast injection between the bone and tendon during arthroscopic rotator cuff repair, and the control group. The re-tear rates were then evaluated in patients at 6 months postoperatively using magnetic resonance imaging. At 6-month follow-up, patient-reported outcome measures were also collected to assess pain, and physical examination was performed to evaluate functional range of motion. Re-tear was observed in 15.1% of patients at 6 months following arthroscopic rotator cuff repair. Additionally, the re-tear rate was significantly lower in the autologous dermal fibroblast group, 5.6%, than in the control group, 24.3%. Both groups showed remarkable improvements in patient-reported outcome measure scores at 6 months and 1 year postoperatively, although no significant differences were noted between the 2 groups. Furthermore, no adverse events related to harvesting of autologous dermal fibroblasts were observed. Overall, autologous dermal fibroblast application to bone-tendon interface during arthroscopic rotator cuff repair significantly decreased the re-tear rate in patients without any autologous dermal fibroblast-related complications. Thus, autologous dermal fibroblast could be a promising treatment option for successful bone-tendon interface healing in patients with rotator cuff tears.